those 6% increases that have been going along up till now, you say, oh, well, how long will it be before we bankrupt ourselves as a province, or the feds get bankrupted trying to put their share into Medicare across the country? Well, that's the big question, isn't it, Michael?
Well, we need the feds to step up to the plate. At one time, you know, the feds used to basically share 50% of healthcare, and that doesn't matter which party was there. Now they only contribute about 20%.
It's about 20, 25%?
Yeah, 20%.
Yeah.
And now that's why Premier McGuinty has said he wants an agreement, a 10-year agreement with the federal government in paying their full share of healthcare in Ontario and not diminishing share, which they have been. So we need that kind of partnership for, you know, to deal with this reality. And it's not just the aging population. It's just the nature of healthcare is becoming so sophisticated and so complex that's making it more costly.
But isn't the simple fact, isn't it the simple fact that you are going to, that Ontario is going to have to make some cuts in healthcare in these coming years in order to survive, in order to be able to, well, for one thing, whittle down the deficit, which you've all undertaken to do within a relatively short period of time? I know you've got spending plans, you can see them in your platforms, but at the same time, won't other things have to be cut? And if so, what?
Well, I think you would ask the Conservatives that because they got a $14 billion series of cuts they're not talking about.
All right, I'm just talking about healthcare.
The critical thing is that every Western country is going through the same dilemma.
Indeed.
Everyone is. The United States, Great Britain, all. What we've been told by the experts like the Romanoff Commission and everybody is that you have to basically get away from just relying on traditional healthcare as we know it, as the hospital, the emergency, the prescription of pharmaceuticals at a moment's notice. We need to get into like the family health teams, the locally based community health centers. We need to have these doctors' house calls. In other words, people shouldn't always be required to get their health care at a hospital.
But that means other things would be cut to pay for some of that.
Not necessarily, because you save the money by not having people line up.
But you don't save it right away. You might save it down the road.
Well, you do, but in the long run, that's where the major savings are going to be, by decentralizing healthcare and have people stay at home and in their community health centers.
What about the bigger issue? Healthcare is going up. The day will come, if nothing happens, we will bankrupt ourselves.
Here's the key issue, Dale. You're absolutely right. The pace of growth has to slow. What we've committed to in Changebook, and I encourage everyone to go and read it, it's available at changebook.ca, is that by the fourth year we'll have increased investment in the healthcare system by $6.1 billion. What that means is that healthcare will have grown by 3% a year for the 4 years, instead of the 6+ that it's been growing at under the McGuinty government. But we've been clear in Changebook as well to say we're going to put the $6 billion more in healthcare. We're going to put an additional $2 billion in education. Every other department from the balance, we're going to get 2% per year for the 4 years of efficiencies. That's how we pay for it, and we've been clear. Now the Liberals, in Forward Together, in their platform book, bury in page 56 of 58 pages, they say they will cut 5% of the civil service, 5% of all government workers. So they need to come clean about where those 5%. We've been clear. We've said we're going to increase in healthcare and education. We need 2% per year over the 4 years in the balance of the operation to make it work. They need to come clean, and Mr. Santa Claus over here keeps saying he's going to add more, and it's only the Conservatives that are making tough choices. Well, that's baloney, because in black and white on page 56 they say 5%. Who are they?
Where does it say in the Changebook that jobs are going to be cut?
2% per year in the areas outside of healthcare and education.
So is that an undertaking that no jobs would be cut in healthcare? You're not saying that.
We are saying that the savings that we're going to get, the efficiencies, the reduced costs, we are going to net increase the investment in both healthcare and education between now and the end of the 4 years.
All right, I'll come back to Mike Cole, and I'll give you both an opportunity to talk about this as well.
Well, we've heard this story before, Dale. I remember Mike Harris said, we're going to cut your taxes, we're going to find efficiencies, and there'll be no cut in services. He gets elected, what do we find? Downloading of taxes on the City of Toronto. 28 hospitals closed, 11,000 nurses or 6,000 nurses fired. What they're not telling you, and the National Post, the Globe and Mail, the Toronto Star all agree, the Conservatives have a $14 billion gap in their platform, and that's going to be $14 billion of cuts that'll be primarily in the two largest areas. You've got to cut in healthcare and education. That's where they will cut, like they did before. So I just tell people, don't believe the story that you heard before.
But what about this thing Rocco Rossi's talking about where 5%?
Page 56.
Well,
on page 56.
He picks these things out all the time.
But if it says it, it must be
The thing that
be true.
I actually read your platform.
Okay, all right.
Okay, sorry for the interruption, Mr. Rossi, but the thing is that we just say, look at the story of the Conservatives. They always claim they're going to basically balance the books, no tax increases, and leave your service.
Okay.
Then they get into power, and they're going, and it's in their platform, $14 billion they haven't accounted for.
Okay, all right, we'll get to that. But I want to hear as well from the other two candidates. Gertie, you first.
You hit right on, and there is no strategy. Right now, we've entered an unsustainability curve in terms of healthcare. If we continue this way, in 2020, we'll have 73% or so of our budget being spent on healthcare. So we can imagine what's going to be left for the rest of the programs. But there is no innovation right now. We have the government has a pay-as-you-go program type of thing in healthcare without an actual strategy on how we're going to make this a sustainable. So it's a public healthcare that can provide the quality services to people that need them most. Here's what that 5% is coming from. It's a cut all across the line. It doesn't matter what the benefit added is of those people that you're cutting. They've cut ambulance dispatchers just as like as secretaries. That's what those cuts were. They've cut the modernization project where I was working at the Ministry of Health and Long-Term Care, which provided over $20 million in savings in 1 year's worth of work for 4 people working in it. And instead of letting us continue it, the modernization project was chopped off. So there is no strategy, there's no will to do things better in healthcare, and that's why we've entered this unsustainability curve.
Josh Rackless, what would you like to add to this conversation at this point?
I mean, clearly none of us are doctors or experts in healthcare necessarily.
No, but you're still the people who are being called upon to
Absolutely.
plot strategy and come up with solutions.
So I talked to my cousin Michael Rackless, who's a doctor and a well-known health expert. He's written many books on it. And he's like, I'm busy right now, but here. He sends me a 50-page PowerPoint presentation. Read this. And it covered the same issues. And basically, his opinion was like, listen, yeah, there's this fear-mongering, oh my God, we're going to go bankrupt. It's not that bad. First of all, the healthcare the percentage of our budget, it's gone up because the economy has gone down. So it isn't going up as much as it is. It's just naturally a larger percentage now. Also, it's not going up at a rate that's going to bankrupt us. The baby boomers are healthier. People aren't getting as sick as much as they were. So it's not as big an emergency as a lot of people are saying. And at the same time, he's saying, what the Green Party is saying, it's about community resources, about being more efficient, having teams of people so that you're not an emergency. If you've got a sprained ankle, you go to your nurse practitioner, whatever it is. It's about being more efficient that way. And at the same time, the Green Party believes the idea behind e-health was right. Obviously, the execution didn't work out that well. Part of the problem was that we tried to create our own Made in Ontario system. And what we should be doing is sort of looking at countries that have a system already that works pretty well, and we can adopt that. We save time, we save money, and we get our records working more efficiently. I can't remember the last time I got immunized or whatever, and I keep going to I'm like, oh, I don't know, and there's no way to figure it out, so I get it done again.
Well, they would have to look through a paper file and spend half a day looking for it.
But I go to different walk-in clinics, and I can't remember which one I went to 2 years ago, so if there was a computer file, call up in the smartphone, there it is, you've saved money. So it's just about being smarter with our money.
Can I shift the focus a bit for you, Rocco Rossi? Sure. This $14 billion thing has come up a number of times. It's come up with a number of candidates. I'd like to hear your take on it. Essentially, you're saying, if I can paraphrase it briefly, there's $14 billion in promises for which you don't know where the money's going to come from. Is that what you're saying? Over to you.
Here it is. The only $14 billion hole in this election is the $14 billion deficit that this government has left Ontario with this year, and they plan to grow it to $16 billion next year.
It's amazing how those two numbers are the same.
Because that's the only hole. Martin Reg Cohn in the Toronto Star, not exactly the greatest friend of the Progressive Conservative Party, this past week wrote a column, and I encourage people to Google it and look right in the Star, where he says Liberal staffers have not been able to justify this $14 billion claim. It is a complete stretch. So I don't know.
Well, what's the real number then?
Yeah, the real number is that this plan, changebook.ca, is fully costed. We're talking about the choices that have to be made.
All the parties are saying that. Every time candidates come in here, everything's fully
100%, but
costed.
we've come clean on the choices, and the Liberals simply are not. They try to bury on page 56 of 58 pages that they're going to do a 5% cut. They also have been talking about public sector salary freezes, and yet we all know that in the back rooms, Mr. McGuinty cut a separate deal with OPSU, where post-October they get a wage increase when he's trying to tell everybody else that it's frozen. This is a guy who cannot control costs. It will only lead to higher
turn around
taxes.
and say, even if you account for what the Liberals are calling your $14 billion hole in spending, can you undertake to say, oh, well, there'll be no cuts if the Conservatives form the government for the next 4 years?
We have said
no cuts.
There will be 2% outside of healthcare and education each year for the next 4 years.
But not a job would be cut in healthcare. Is that what you're saying? Not a job.
We will invest by the end of the fourth year. We will have $6.1 billion more, which is precisely
that's not what
the
I'm
number.
asking.
It's precisely the number. It's precisely the same number that the Liberals are offering in their book.
Well,
it's a 3% increase.
To which you would say?
We've had independent economists look at our platform. We are the most modest in terms of what we're promising. The Tories have basically said, we are going to maintain services, spend as much as the Liberals, yet we're also going to give billions in tax cuts and all these other promises they're making in their platform. They haven't accounted for it. It's been a blatant gap that we've never seen before. During elections, platforms come out, but this Tory platform is a joke.
Voters out there have seen a lot of platforms over a lot of years.
This is the biggest joke ever.
Oh, well, okay. Gertie, let's go back to you.
I don't think we should cut anybody out of the healthcare system. I think we have a lot of work to do. And with so much work to do, I think we can put people to better use. We can achieve efficiencies by actually using these people better. Mm-hmm. It's not about a choice, cut or service. I think it is very possible. I have demonstrated in my work as the Minister of Health and Long-Term Care that it is very possible to do more with the same budgets that we have. Let's first achieve that efficiency, make things run more efficiently.
You're talking about the things that Dr. Jeff Turnbull brought up, the CMA president, who said, really, the part of the solution lies in reorganization, getting the right people in the right jobs. It's a muddle. The improperly motivated people are in the wrong jobs, and a whole list of things beyond money.
Right. Let's use people more efficient. That's what good management is about, right?
Well,
let's get the people,
let me go to Josh. I'll come back to you.
Where they're more
Josh?
efficient.
I mean, I can jump in and say all the same things, right? But I think as the Green Party member, I'd just like to say, hey, let's remember that our goal as a province should be to prevent people from getting sick in the first place. If we get rid of coal power, suddenly you have less people having asthma problems, winding up in the hospital. You save money. I mean, I think that's really what we should be focusing on. How can we cause people to get less sick, and then we'll save money in the healthcare system that way, rather than discussing.
People are still going to get sick no matter how healthy they are.
But the less people who get sick, the more money you have to take care of them.
Okay, back to you, Mike.
Yeah, I know it's especially in their DNA of the Conservatives to bash healthcare in Ontario, but we have some of the finest hospitals, like in Toronto. We've got, whether it's Sunnybrook, Mount Sinai, St. Mike's, we've got the new William Osler Hospital. We've built 18 new hospitals in the last 8 years. We're building another one at Keelan Wilson. We're providing these new family health teams, nurse practitioners. We're immunizing for 28 diseases now. We used to immunize for 2. We've got an amazing, talented group of people work in a healthcare system. Doctors, nurses, technicians. These people provide, I think, one of the best healthcare systems in North America. And sure, there are efficiencies and there's improvements in a system that basically treats 13 million plus Ontarians can walk in the door anytime.
Okay.
So
right,
it's a pretty good system, despite its
Let's park
faults.
this for a few minutes and see if we can't get on with a few other things. We've mentioned it briefly here and there, and that's the